Dr. E. Fuller Torrey specializes in dealing with severe mental illnesses, such as schizophrenia and bipolar disorder.
We have the ability to treat them reasonably well. We can't cure them, but we can make their life much, much better. And it's really quite shocking that we do as poor a job as we do, both in New Mexico and in most of the other states as well.
Dr. Torrey says communities with few mental health resources need to prioritize cases.
One thing they can do is to focus on the people who are most seriously ill and who are causing the most problems. There's a group of people with schizophrenia and bipolar disorder who are in and out of jail, they're in and out of homelessness, sometimes become violent, and if you focus on the people who are sickest, you'll actually find that it saves a lot of money in the long run because these people tend to take enormous resources. We often say that 10% of the mentally ill utilize about 80% of the resources.
Dr. Torrey says community members also need to work together to pool limited resources.
Perhaps the most important step is actually what we did early this morning. We had a meeting with about 20 people from the community, including people from the jails, people from the service sector. They need to get together on a regular basis, probably monthly, to get together because no one of them can solve these problems. It's only if you coordinate these things together that you can start to get on top of it. And unfortunately, that hasn't happened very much. Each of the segments in the community tend to be very separate, and they tend to work very independently.
Dr. Torrey says mental health reform takes strong leadership.
Here you've got a behavioral health division in the Department of Health, which I must say personally has had some very poor leadership over the years. If you don't have good leadership that's willing to focus on the severe problems, it's not going to happen. So I would ultimately hold the governor responsible, who has to appoint people running the Department of Health. And if you start to make that a public issue, when they're up for re-election, that should be an issue. How are you doing on treating people with severe mental illness?
For KRWG, I'm Samantha Sonner.